Hi, I'm Peter Llewellyn of NetworkPharma TV, and this is one of my unscripted conversations, as I like to call them, where I get interesting people to come and chat, and hopefully we'll have something interesting to share with you. So let's see what we learned today. I'm joined today by Martin Delahunty of Inspiring STEM Consulting, and to set some context on this conversation, Martin, you're an advisor to the Asian Council of Science Editors, ACSE. I know a couple of weeks ago you led a webinar, which I listened to, about the responsible use of AI in scholarly publishing. And that's the area I wanted to focus on today specifically. Okay. So before we get into that, Martin, just do us a favor, just tell us in your own words who you are and what you're doing and how you got there.
Good morning, Peter, and thanks for inviting me on. Yes, I'm Martin Delahunty. I'm director for Inspiring STEM Consulting, which is an independent consultancy that works across publishing, pharmaceutical clients, anybody involved in publications and all the business around publications and scholarly publishing. Prior to that, I was global director with Springer Nature, and I've been around scholarly publishing for a little over 35 years, so giving my age away there. And more recently, I've been working as a consultant around artificial intelligence, of course, which is what we're going to talk about today. I'm also president for the European Medical Writers Association, as you say, and another hat I wear is the advisory cabinet member for the Asian Council of Science Editors. So I've got a mix of roles that I interplay, and we can sort of bring that to play into our conversation today.
Absolutely fantastic. And thanks, Martin, for giving us the time. So I guess it's worth for transparency. We've known each other for quite a long time through the work I've done through Medcoms and all the rest of it. It was a couple of years ago now, probably, what was it, January 2023, when we first ran a webinar, which I think was the first webinar that had been run in and around our sort of business, which talked about generative AI. It's only 2.5 years ago, sort of thing. Since then, you seem to have made a bit of a name for yourself, and you focused a bit on the AI. And I just find it fascinating how fast things have changed. And I find it quite bewildering, to be honest. There's lots of different aspects to it, but you specifically from a scholarly publishing point of view, I guess, have seen very, very rapid change, which is still happening, isn't it?
I mean, the velocity of change is extraordinary. And as you say, I'm actually grateful for you, Peter, to ask me to jump in fairly straight away in early 2023. If you sort of think back to November 2022 when ChatGPT was launched and everybody went, wow, what's this? This looks extraordinary. And then, of course, that shook up the publishing industry to begin with. And we had our conversation. And I think like everybody else who we're not coming from an IT background and not familiar with artificial intelligence and machine learning, of course, which is around for decades. Many of us then had to do a deep dive into what is all this about? What are the consequences? And I think the great thing that you do and many others do is to create that facilitation and exchange of knowledge. So I think early in 2023, we were all, I think, quite defensive in not understanding what this was about, but thankful for the opportunity to exchange opinion and exchange whatever information people had across various stakeholders within publishing and medical publications. I think worked quite quickly as well. So moving on to various other touch points, through 23 and then last year and up to where we are now, it really is extraordinary to think how things have progressed and how thinking has progressed. Naturally, how the tools have evolved, and we've got a multitude of tools. We just take, scholarly publishing and medical publications. We've got hundreds of AI-enabled tools. Whether they're authentically AI or not is another question. One of the challenges I'm finding now and everybody else is finding is that we're having to cut through the hype of these amazing promotional campaigns that we see left, right, and center. And cutting through that hype to try and get to reality is still a challenge. But I think that's where we're getting to now. Last year, it was all about potential, the hype, what we could do, and lots of nice demonstrations about methodologies that are enabled and empowered by AI, and some, challenges and problems being addressed with solutions driven by AI, which is all very nice but conceptual. We're getting to now, let's show us the money, literally, show us the reality, give us proof of concept. And those are challenging questions for some of the vendors that have developed products and tools that look very innovative or addressing problems. Looks like they're providing a solution, but when you ask, can you give a proof of concept? Can you show me, if it's in a medical publication context, can you show me data around 100 clinical study reports that have been processed through your new Microsoft Copilot, and what is the time efficiency gained, and then what is the error rate on the other end, and then what is the human on top of that error rate that you need to resource to address the quality control at the output. Those are really healthy, challenging questions at the moment, but we weren't asking those 12 months ago. So I'm looking ahead in another 12 months and thinking, where will we be? And I think where will it be we've talked, I think probably talked, and you have many people on your podcast and webinars previously talking about the Gartner hype cycle. So this Gartner hype cycle is that, early 2023 with AI, this wave of enthusiasm, we get to a peak of expected, inflated expectations. And then we go, whoa, we've got this trough of disillusionment because we're just confused around what all this means. And then we get to a peak, a level of enlightenment where we've cut through all the hype. We've probably got rid of a number of tools that were out there 12 months ago. I'm actually seeing that right now. I won't mention the tools, but I'm seeing tools that are fading away already because they've been asked that really challenging question. Just show me the data, show me the proof of concept. And they're unable to do that in a real world context. So I think we will see in the next 12 months some enlightenment around AI, generative AI powered tools that will be beneficial, that will be backed up with data, that will be backed up with, I'm seeing some nice peer-reviewed studies that are published in peer-reviewed journals, where we've got a level of confidence around the data that's being proposed around a new tool. You want to see more of that. So I'm encouraging when I'm talking to a lot of companies, publishing companies, but also agencies, medical writing agencies, and I'm trying to get them to that point where they're comfortable in some way or form of sharing data to show a thought leadership position, to actually say we recognize that there are frailties, errors, problems with these tools. There's potential, but the potential has yet to be realized. And what the other discussion is, not to rush to implement tools at the expense of cutting costs and cutting the main cost that would be cut with the implementation of AI tools is human beings. So the rush to do that is, I think, problematic, because you're going to find in 12 months' time that these tools are not delivering, and you're going to have to rehire people or do something different, but you put yourself in a long-term problem, I think, by moving too quickly to implement tools. So I'm encouraging those that are already up and running, and I'm seeing very nice examples of companies and individuals that are up and running, testing tools. They may have been doing that for 12 months. That sounds great, but they're saying this is like a 2 or 3 year process of evaluation, consolidation, adaptation, and we're not going to do that at the expense of cost cutting right now. It's a long-term investment. So I'm trying to encourage that, particularly when I'm talking at board level. Naturally, if you're at board level and you see these, you see 60, 70% time efficiency saving in processing documents, in the medical writing and medical communications world, that's like, wow, and you're seeing that definitely. However, at the other end, you're seeing maybe 50% accuracy in terms of the output. So you still have to QC that other 50%. And who do you need to do that? You need your expert medical writers, medical communication specialists. You need human beings in the loop. And, it's a really interesting space to be in. It's, as you said right at the beginning, it's moved so quickly that the velocity of just discussion around this is moving very quickly. So the meeting that you mentioned, the Asian Council of Science Editors webinar, was really insightful for me. As you probably know, Peter, I'm always open to an invitation. So to whether it's a nice drinks event for MedComms networking. I remember up in Oxford coming out to see you, but I'm always open to somebody say, Martin, can you come give a chat, give a talk, or in whatever context. So I was really pleased that the Asian Council asked me, one, to be an advisory member. I liked the work that they were doing. And then we set this webinar up, as I might have done previously. We had a publisher, so we had Dr. Rick Lee, who's the general manager with World Scientific Publishing in Singapore. We had Jonathan Lee from Takeda Pharmaceuticals in Asia. He's also leading the ISMAP Asia Pacific group, which is great. And then we had Adam Day from Clear Skies, which is a product aimed specifically, an AI-born product, specifically aimed at identifying fraudulent papers before they're published. So that's been very successful. So we had maybe a usual mix of stakeholders, but I walked away with a huge learning, which was around the cultural context. The cultural context in Asia is very, very different in publications and in the approach and adoption of AI tools. And I think I'd forgotten that because I was so maybe immersed in more Western orientated discussions. So we need to think holistically about cultural aspects in implementation of AI tools and how they may affect that. And certainly in designing generative AI tools around publications, that they should absolutely have a cultural context and to have people that understand that cultural context, because that's not the case with OpenAI and with Anthropic, which is the Claude AI company, and the other companies, Microsoft. I don't think they're really taking that cultural context and sensitivity and diversity into consideration. And I think it's a good part of these kind of conversations where we've got groupings coming together to say, no, this is important. And we'll continue to say it's important until we see it in action. So I learned a lot from that. I think I'd forgotten the cultural context, and It was a great reminder to me. And that's, again, why we should be having these open conversations and where possible, being honest about the frailties with these generative AI tools, the realities. It's too easy for all of us to say amazing efficiency gains. We'll worry about the QC a bit later on, but this is the direction of travel. It's a panacea for the publication, scholarly publication world. No, it isn't.
I mean, my goodness, you've covered an awful lot of ground there. And one of the things that I remember you saying in that webinar, which is worth noting and agreeing on, is that at the moment, I can't remember how exactly you phrased it, but it was along the lines of none of us can explain how it works anyway, sort of thing. And the techies, let alone us, we can't explain how it's working, which makes it actually quite difficult to figure out what we're supposed to be doing with it. And the other point, which I always like to say, and I think, again, you mentioned in the webinar yourself, how we use this term AI like it's something. And actually, it covers an enormously broad spectrum of activity, tools, and so on. And you've already implied early on in what you were saying there that, what we talk about as AI is not necessarily AI anyway, sort of thing. Yeah. So all of that leads to a very confused conversation, doesn't it? Yeah. I mean, you agree with that? Yeah.
Absolutely. Yeah, it is. Yeah. And, even, OpenAI and Anthropic, will openly admit that they don't quite understand how it works, which is crazy for companies providing the service. So, and we, for those of us, so, I can't be talking about AI for the past 2.5 years without actually adopting it for my work. So I've tried and tested a number of tools, and in my particular set of work, one piece of work, big piece of work that I'm involved with is producing reports. So very time consuming. I'll use market research data. I'll use data from publication databases, bibliometric databases like Web of Science and Scopus, and produce spreadsheets, and then do narrative around data, and then do forward thinking around strategy, all of that. Big reports. Maybe the reports I'm putting together would be 20, 30 pages, 100 references, probably 20 different big data sets that I crunched down. All of that would have been done manual. And of course, I couldn't be talking about potential adopting of AI within whatever business sector and publishing without considering it for myself. And so I did nicely talk to people, consultants who were doing the same work, similar work to me. And again, in the consulting world, what we have is quite a nice exchange, although we're competing. There's a nice exchange of information, recommendations. We can manage our conflicts of interest. Obviously, that's particularly acutely important for consultants. And I asked around, and I asked those that I knew were doing similar reports to me, and I came back with a recommendation, which was Claude AI. And then I've been testing that over the last 4.5 months for my work, and it has been quite extraordinary in terms of my ability to do to increase my efficiency and also to do more innovative things that we might have taken more time without using a generative AI tool. But there's still limitations. So I've been learning by doing. I have my own protocol set up of my own work process through trial and error. And I think many people are doing that. At the end of the day, I still have to take responsibility for the content that I produce. If I have a 20, 30 page report and 100 references, and 99% of the references are perfect, it's that one reference is out of kilter, that doesn't look good to me. So I still have to check everything still. The level of confidence isn't there. So I would expect many people who are already testing use of generative AI tools in their particular work process are trialing and erroring, finding what works, putting their own protocols together, but still understanding that you need human oversight. And you talk to big companies that are using AI to process large volumes of documents in whatever circumstance. Again, they will tell you they still need the human component, the human expertise. And in the medical writing world, I think that's fantastic because it does reaffirm, and the conversations I've been having, doing some training and some consulting, is that it still comes back to the differentiating factor for a company using AI tools, company A versus company B, is your people, the expertise in your people. The processes themselves are going to be exactly the same. Ultimately, you're going to begin to get this little slope of enlightenment where from the hundreds of tools, we're going to come down to 3 or 4 or 5 core tools that are being used. As we have had in medical publications way back when there was digital transformation and consolidation of databases that publication professionals have to use, working with pharmaceutical companies for compliance, etc. All of this, it comes down to a small set of trusted, accredited tools. I think we'll come to that. But the differentiating factor for one company over another will still be the human intellectual capital that you have. So I try and reinforce that when I'm talking to people at the operational level within companies. Of course, what they have is the downward pressure from the finance people and the investors are going, wow, 60, 70, 80% efficiency in the process, let's cut costs. No.
If we come back to, specifically with scholarly publishing, and I'm trying to put myself in the mindset of a publisher, a lot of what you've talked about there is about your own process and work efficiency and so on. And there's a conflict in there in terms of, as you say, can I gain 60, 70, 80% of time saving, and how does that affect the sort of the quality and all the rest of it? A lot of that's about the process internally, though. But what I'm slightly interested in, what's the current view from a publisher's perspective of what the author should be doing? Should an author, have we gone beyond the point where a publisher says ye shall not use AI in generating a paper, and how does that play out? Because I've always had, I mean, for the last couple of years while we've been talking about this, I've always had a problem with this aspect, because there were, and bring me up to date, there were publishers who were going, you cannot use AI, and you go, well, how do you define AI? And as using a spell checker, contradicting this sort of thing. There's a spectrum of using AI tools supporting you producing good science, communicating it in a useful way. Maybe English isn't my natural language, for instance, so using it to improve, etc. There's all that aspect of it versus just literally pushing a button. I'm not sure it's really that possible, pushing a button and producing some paper magically out of nowhere, and me as an author just handing it over and not really thinking about it. I mean, there's a wide spectrum of activity in that. So just bring me up to speed on that point from that perspective, what the publisher's doing and how are they guiding their authors in what they should or shouldn't be doing?
I think publishers realized, again, back in early 2023, just over ChatGPT headlines, naturally, publishing industry, I think, was very defensive. Suddenly, they could see a threat, and the publishers, big publishers, Nature, Science, Taylor & Francis, they actually moved very, very quickly to address the understanding that authors would already be using AI. There's no way you could say we're going to ban the use. The genie's out of the bottle. That's not going to happen. So they were, I think, nicely pragmatic in saying, well, what we want to do is set guidelines straight away. So to say that we want disclosure of use of AI by authors, that AI cannot be an author. As you might remember back in, again, 23, there was an article published in a nursing journal published by Elsevier, which it was an editorial, but it was co-authored by ChatGPT. So a nice bit of promotion. Obviously, people are up in arms. How can ChatGPT an author? Well, of course, it can't be an author, because an author, human being, is the only entity at the moment that can create copyright material, for example. So you human being can only be an author of content that has ownership rights, has intellectual property. And so the publishers moved quickly just to set up the barriers to begin with. But the genie was out of the bottle. And so what they would clearly recognize is that through the back end of 23 and 24, that the exponential use of AI tools by authors meant that apart from the benefits, they're more focused on the threats. And the biggest threat was the amplification of pre-existing fraudulent publication activity. So paper mills, citation rings, it just made it a lot easier to generate more volume of that fraudulent material. So that amplification happened, absolutely, is still happening. It's a major threat to research integrity within the scholarly publishing ecosystem. That's why you have seen every major publisher creating a research integrity division, resourcing it with dedicated people, and bringing tools in to try and push back on this wave of amplified fraudulent material coming in. So product, again, I mentioned Adam Day and Clear Skies, which is a very innovative product to try and identify on submission authors that are potentially fraudulent or content that's fraudulent. And so it's a sophisticated tool that red flags potential fraudulent papers before they're published And through 2023, there are tens of thousands of papers, unfortunately, that suddenly had to be retracted because of identifiable fraud. And that was only the tip of the iceberg. So it's a real problem. But as you say, the benefits are not talked about enough. And I think we need to get to more discussion around the real benefits for authors that are responsibly using and AI, and also are being taught to use AI. And I remember, again, thinking back to 2023, when we had our webinar, I think it was January, February, quite early on in 23, when we had that first chat about what is all this about ChatGPT. I did a bit of research, and I found that the early rapid adopters of these AI tools were college students in the United States. So college students who are asked to write essays as part of their assessment. And of course, that made it super easy for them to do that. So there's prolific use of AI tools. And many of the schools had cottoned on to that, and they said, we're going to ban use of AI tools. We have to ban it. There was one college professor who said, we can't do that. It's pointless. So what he said is, conversely, I will actually stipulate that all my students must use an AI tool, but an AI tool that is approved by me. So I would expect that any work that you present has been as part of a process of using generative AI, that you have used it as part of the process. But I expect all my students to go on a training course. So they're beginning to set up training courses for students to responsibly and appropriately use AI. Again, he recognized that the genie was out of the bottle. There was no point in trying to ban it. That was just impossibility. So I'd like to see more of that for authors, responsible use and training for AI. And you've got people like Abby Stamen, who's great, who provides that kind of training at that level for researchers for responsible use of AI, how to create a prompt, the mechanics of, the process of efficiently using a generative AI tool. So I want to see more of that training, and perhaps publishing companies facilitating that, so that they're seen to be, providing that, as publishers have always done. We've always done how to get published courses, how to peer review, fantastic. How to responsibly use an AI tool. That would be a great course right now, because it would put publishers more on the front foot, that we're actually taking some responsibility for appropriate and responsible use of AI. And then coming back to the Asian Council of Science Editors, again, just gave me a little bit of a kick to say, you've got to really remember the cultural aspect. And as you said, Peter, one of the benefits of using a generative AI tool is for those researchers and academics whose first language is not English. And so for them, it's a boon. It's something that really will help them more effectively communicate in the English language, which is still, in the science and academic world, is the primary, modus of publication. So they have to publish in English. But having a generative AI tool that helps them communicate more effectively is fantastic. So recognizing that as a positive, beneficial aspect to generative AI that's culturally relevant, we need to think more about that.
And just to flip it, I mean, we're going to run out of time, so we need to wrap up, but just to flip that around slightly as well. I mean, another thing that gets me excited is the opportunity for the audience to have greater access to the content, in the way that an author, English might not be their first language. The readers, often it's not their first language. So the sort of tools that you can start to imagine now a publisher providing, so that a reader can access this scientific paper in ways that are much more tailored to the individual, whether that's a level of language or a language, or visualizing data. And I mean, there's some of the tools these days which can convert text into images. I mean, the opportunity is amazing. I suppose I just fundamentally wonder how fast the publishers are going to run with that, as opposed to defend their basic position as gatekeepers of this content? Is that a fair question to raise?
It's a fair question. It is a challenge for publishers, but I think publishers need to be more open to taking, and it will be a risk in whatever they do around, developing capability for generative AI tools. That you have to be taking that step. Otherwise, you're going to be left far behind, and you have to approach it with as open a mind as possible to find the benefits. I mean, accessibility. The European Accessibility Act came in this year, so it's in force. So again, thinking about those sectors within scholarly publishing community that can be marginalized because of disability, generative AI tools allow then the decoding of complex information and communication of that, whether that's a visual communication or audible communication. That's huge benefit to those with disabilities, or we need to recognize that as well, to have more inclusivity and access to the scholarly publishing records, the academic record, to advance everything that we want to do that's good in the world, hopefully, and we need that at the moment. So yeah, it's just thinking again. What I found with generative AI is that it's made us think about fundamental aspects of scholarly publishing that have always been there, that we've not questioned. It's how it's been, but asks us to reaffirm and question again what we do, and that's really, really healthy. And that's been true for every disruptive technology, whether it's been the World Wide Web or the early digitization within scholarly publishing. I started in 1989 as a copy editor and a proofreader. I had a red pen, blue pen, in tray, out tray, no computer. The managing director had the computer. That was like, wow, he's got a computer. And that was it. And you just think, through that, the next decade in the 90s, the massive digital transformation, which is the disruptor. And then the next disruptor in the 2000s was the web. And now AI is definitely a disruptor.
Okay. But fundamentally, your outlook is positive.
My outlook is positive. That's my outlook. But I'm looking again. One book that I have on my desk, it's normally back there, but I'll put it here, is Deep Medicine by Eric Topol,
right.
Superstar of the medical world, fantastic cardiologist and a fantastic writer. So he wrote this book it published in 2019, so he was writing it about 2017. So his book Deep Medicine is about how artificial intelligence can make healthcare human again. And so he's coming back to, yes, we'll have this amazing technology. However, in his context, it's about giving more time to doctors and physicians to spend time thinking about the patient rather than being bogged down in bureaucracy, in process. It's giving more time for the patient-doctor interaction. So that was his premise for that book. I don't think he's changed his view on that, but his forward looking is very prescient, because I think that's where we'll get to just in the healthcare sector. That we're seeing that in the National Health Service here in the UK, that you walk in, I don't know if you've been to a GP practice recently, hopefully you haven't the need to do that. If you've done that, as I've done, the GP says to you, I'll just let you know that this conversation is going to be recorded by a generative AI tool. Is that okay? Okay. Yeah. So we'll see how it goes.
Okay.
But I'm positive. I remain positive.
Okay, but we'll see how it goes. Okay, maybe that's the line to leave it on. Okay, look, we're over time, so we should stop. Martin, thank you so much. It's fascinating to listen to you. I know I can talk for you and say that anybody who wants to follow up can do so directly. LinkedIn is an easy way of doing so, yeah. So hopefully people will take advantage of that. If anyone's interested in what I'm doing, NetworkPharma TV, or follow up on LinkedIn and so on, I'd love to talk to you. But on that note, Martin, a quick wave and we'll say goodbye to everybody. Thanks very much. Take care.